All right, awesome. Good morning, especially if you're on the eastern side of the United States. It's 8 a.m. Welcome to the jungle. I'm super excited to be joined this morning by Sarah Steffen, and she's founder of Health Bob. And I'm discovering here in quarantine that all the cool chicks' names are Sarah.
Really?
I've talked to
Not
Sarah,
surprising.
several Sarahs, and they've all been totally cool and totally smart, and we've just gotten on and jive. So I'm really excited. I feel like this is going to go good places.
Good.
Awesome. So we're going to dive into Health Bob, which, I can't think of a more important time to be talking about this because you are a tech startup and really you're centered around chronic condition management, which is something that we've been hearing with COVID is it's not so much COVID, but COVID starts to impact all those other things if you already have health conditions. So if you already have lung issues, then you're more apt to be hit harder than maybe say me, in my 30s and, not a whole lot wrong with me. I'm in pretty good health. So let's dive into kind of how you got into this, how you got into the health sector and why you knew that the Health Bob app was needed.
Sure. So I have been working in the health sector my whole career. I started as an executive assistant at a free clinic, which was really good for my organizational capabilities. And I got to shadow board meetings and learn more about the business in healthcare. And then I was an AmeriCorps member. So I was in DC doing HIV testing. And then I worked in private, corporate America job for about a year and a half as well. And I used a lot of electronic health record technology in all of those jobs. And I kind of saw how some physicians were much more comfortable with EHRs and electronic digital health than others. And then on the personal side, I'm a physical therapy patient, and I've been journaling my symptoms on paper for the past few months.
Nice.
And I'm not very good at it. Even though I'm very organized in my work life, I find that I often don't take the time to really journal, all of my symptoms.
Yeah.
So I was looking for an app, like a symptom tracker, where I'd be able to securely share my data with my provider. And I couldn't really find what I was looking for. So that's where we got the idea.
Awesome. So it's an app, and kind of walk us through how it works, right? Because it's tracking the condition through wearable data.
Yeah. So it depends on your condition. So some people need to track their heart rate. So you can do that with a wearable device. And it's an interesting time to be in this sector because we're getting more devices that are Bluetooth enabled, like there's Bluetooth scales and Bluetooth blood pressure cuffs. So as that technology evolves, you'll be able to get more data to come from a wearable into, an app or directly into your patient portal from your doctor.
Yeah, awesome. So you had this idea, and what kind of happened to say, okay, now we need to build an app around it and make sure all of these things are connecting and working? Because I, even as a founder of a business myself, sometimes I get what I think are probably really cool other ideas. And I think, man, that would probably be really hard to take to market, right? Even if you think of something as simple as a lotion that seems similarly simple, right? You still have to test it and make sure there's not stuff in there that's going to make most people break out, and you have to go through this whole process. So what was the process of taking this idea that you had and then turning that into an app?
Sure. So we're still in the process of actually building the app. We're in the business plan, the board building, and the minimum viable product testing phase. So we haven't actually developed all of the software yet. But yeah, I think what really helped me was talking to other founders in my social circle who have been entrepreneurs. So I knew 3 or 4 already, and then they introduced me to other founders, and then taking their advice. So some surprising advice I got was to establish your board really early. so that you know that you have expertise on your side when you go pitch to investors or do, accelerator applications. So having those cumulative years of experience from our 20 or so board members has been extremely helpful to move down the right path.
Yeah, yeah. So what have you found thus far has been maybe one of the hardest parts of starting a business and seeing it move forward?
Yeah, so I, of course, have lots of energy and passion for this project, but never having founded a business before and, not having that experience on my resume of, yes, I had a successful exit, it's a little harder to break into the market. Mm-hmm. So I've heard if you have someone on your founding team who has had a successful exit in a startup, it can be really useful. I don't currently have anyone on my team who has that experience, but that's, something to consider if you're putting together a founding team. And then right now, just the funding for new startups is, it's not a great economic time for most of the world. So I think it remains to be seen how venture capital and all of that is going to react, but it's certainly not necessarily the easiest time.
Yeah. That's an interesting point. And what are some things that you as Health Bob are trying to do in that space of stand out now, but also as we move into the future, right? Because something else that's kind of surrounding the conversation around this current virus is we all know we're going to come out on the other end. We don't know when. And even when we think we know when, that date keeps changing, but we all know we're going to come out. So we're all like, if we can just survive, whatever that means for you as an individual, then we're going to come out on this other side. And then everything's going to go back to some type of normal, right? Like we're all missing our favorite restaurants and we're going to want to travel because we've been in our homes forever. So there's a lot of talk of prepare now for what's going to come. So how are there things that you were like, ooh, I need extra time to be able to do that piece. And now maybe you have it so that when everything goes back to normal and you're at your next pitch event, you're going to knock them out of the water because you've had all this extra time to kind of plan. How are you using the time to get ready for what's coming?
Yeah, we're definitely working on our business plan. That's another thing. Well, I say having a business is like having a child because everyone has an opinion on how to do it correctly.
Right.
So,
I have you up at all hours of the night.
Yeah.
Get you up early, keeps you up late. Yeah.
Yeah, I have a lot of advisors and they all have a different business plan format. So we have 3 different versions right now that are all the same information in different formats. But I think it is helpful because different investors want it in different formats, right? So I'll have all 3 ready, which is good.
Yeah.
And then I also think with coronavirus, we're going to see big shifts in just how healthcare delivery happens in the US. So we'll be moving towards telemedicine probably permanently, or a bigger market share will, embrace that technology now that they've tried it once and seen that it works.
Yeah.
So we're trying to figure out how to position ourselves as a complementary service to telemedicine. So if you, have a virtual visit like this, say we were having, a therapy or a doctor's visit right now, then could I enter my vital signs into my app, through Health Bob and send it to my doctor and they would get it in their chart. So if there's a way to, leverage that opportunity in the market and, prove that this is an enhancement that providers and patients would also benefit from. So there are some opportunities that will come out of this, and there have been some changes in law and insurances are, trying to catch up. Doctors are trying to catch up. So we'll see. It's a little hard to predict, obviously, this early.
Yeah. Which is, it's kind of interesting to me because we've been talking in our house and it feels like telehealth, teledoc, meeting with your doctor like you and I are meeting now. It was almost like well, that's because it's what I want to do, right? Like I'm kind of not feeling that well, but I really don't know what's going on and I really still need to go into the office. So instead of having to make this trip to the doctor and I need to go to work, I'll just, do a Zoom meeting or something like that. and it's developed into this, no, that really is how you have to meet your doctor unless there's, you know, an emergency or something like that going on. What do you feel was maybe a stopgap in that? Like, and it might be some things that you're doing in your own work, in the sense of, are we still afraid to have our health information tracked from a wearable and then communicate that to an app? Or do we feel like we're not getting the connection with the doctor? Because I would almost feel even closer to that doctor having the one-on-one time with him like this. Like, it just feels like it's different. You're not in an office where you're dealing with multiple people and going through the steps and having to be rushed out, right? So what are some gaps that we just kind of, as a community of people, have maybe hindered that movement forward of the technology, or that you've seen where we're like, ooh, we're not ready for that yet?
Yeah, well, I think it's a give and take. The provider has to offer the service and make sure that it's a high enough quality service that it will suit the patient's needs. So when I was training on electronic health record technology, it was so fun. It actually was very fun. We did a lot of sort of like mini sales pitches to providers on telehealth platforms that we had as a medical group, and we could offer them. And one of the biggest points for the training, which is what I did, I was a trainer, was talking about which conditions are really suited to telehealth and which conditions aren't. And we also had like an urgent care, like virtual urgent care, which is a little different because, you can't do all of the physical exam virtually. Right. And sometimes the advice you would get at the end is like, okay, go to an urgent care, go to the hospital. But just for primary care, we can just start there. I think the provider really has to be confident in their ability to treat you virtually. So they need to embrace technology. They need to have a good internet connection and secure connection, of course. Yeah. And then they need to be trained well enough to know the questions to ask and to make it still feel like you have that rapport. So I think if your provider confidently, tells you, okay, next time we're going to talk about your hypertension, we're going to do a virtual meeting. I have this great setup where I'll be able to have more FaceTime with you. You'll be able to pay your bill or send it to your insurance like easily right after the visit. And then you can take a survey. I think that empowers the patient, to embrace that. So I think we want to hear it from the experts that they want us to try this.
Yeah. Well, that makes so much sense because absolutely. I mean, not every meeting could be a digital one. That there would be things, especially if it's an ongoing condition that you're monitoring, that you would have to go in to the doctor's office. So, all good points. Okay, so I want to take us back a little bit to coming up with the idea and founding the company. We'd kind of talked about how you were in the corporate world and you kind of smiled. And I'm curious, what inspired you that you were like, oh man, I need to go out and create this thing and have my own company? Because there's almost like when I talk to other entrepreneurs, it feels like this itch, right? That we're like, I need to do a thing. And then one day it's like a thing or something happens and they're like, and today is that thing.
Sure. Yeah, well, I think I've just realized I've probably had 3 or 4 different bosses over the last 4 years. Postgraduate life, you change jobs every year or two. And I've sort of realized that I'm very independent, and I think that there are like founders and then there are sustainers of businesses, and I'm more interested in like the founding aspect of business. And by the time I've been at my other jobs, they've all been in like sustainer mode, if that makes sense. So I've always tried to start new projects within each of those workspaces and like take ownership of that project, which has been great. But then, once I realized that it was time to like look for a new opportunity, I realized that I would be probably happier if I had, control over the whole project. So like a whole new thing.
Yeah, I love that. So how are you and I got connected through LinkedIn. How are you getting the word out about Health Bob? How are people coming to you and getting acquainted with the program?
Yeah, I think we're on multiple platforms. We are on Facebook, LinkedIn, Instagram, and then we have like a GoFundMe page and I Fund Women, which is like a women entrepreneur focused fundraising page. And then we also have a website. And we just made our first video, so we're excited about that. So that's on our website. It's on YouTube. We worked with a production company called Story House North, and we loved working with them. Nice. So it's been a lot of word of mouth, and then we've done a pitch. So we went through Founders Live, if you know them, and you get great benefits just for pitching. You get like Amazon Web Services credits, and like there's a lot of great networking that happens in Minneapolis. There's an organization called healthcare.mn that's been great, and it just opens up your connection possibilities, I'd say.
Yeah. So how are you finding these networking events? Is that through like the board members kind of have those connections there and they're bringing them to you, or how does that work? How do you get to, because I know it's not you just show up and pitch your idea, right? Like there's this whole process that you've got to turn in paperwork and then they approve you. So how does all that work?
Yeah, so we've done Founders Live for a pitch, and then we're going to be doing a 2-day event with Seed Spot, which is like a launch camp, and that culminates in a pitch also. And I think you can find a lot of them on like entrepreneur discussion groups on Facebook or LinkedIn. If you even just follow like certain hashtags, like different opportunities will come up, even for funding or grant applications. So I think it's just being really persistent and looking through all these pages, and some of it might not be relevant to you.
Yeah, for sure. Okay, and if we say I wanted to download the Health Bob app, how does that work? Like, do I just get to connect to my Apple Watch and it tells you all the information?
Yeah, so it's not currently live yet. We're going to be doing beta testing with a select group of providers first, and then it'll have a general release. But the idea would be that, yes, once it's available, you would just download the app, on the Apple or Android app store. And then if your provider is participating, they would set up what they want you to monitor. So say you're newly hypertensive, they would say monitor your blood pressure once a week. And then you could get reminders on your phone. Okay, it's time to go to the pharmacy and get my blood pressure read. Nice. And then when you actually input it, it'll surface that data to your provider, not in real time, but probably like once a day. Depending on the condition, we'll have different, time limits set up. And then your provider will be able to take action on those results without having you come in. So usually for new hypertension patients, you have to come in, say 4 weeks later, and bring your 4 blood pressure readings. Yeah. But in this case, they could monitor and see if it's really high for the first 2 weeks. They might call you in right away and say, okay, let's start you on medication because I see that the trend is already holding. Yeah. So you could, get in 2 weeks earlier, for example.
Yeah. Which is interesting to me because that also seems to go back to helping the issue of not crowding doctors' offices and being a little bit more intentional of when you can schedule someone, that if they need to be scheduled, right? If there was something else going on, maybe you could get them in earlier, or maybe if they don't need to come back because all the levels are looking good, then, the doctor could say, hey, don't worry about it. We're going to keep an eye on this, but you're looking good and you don't even have to come in. I like this.
Yeah, definitely.
I'm not going to the doctor unless you just have to.
Yeah. Right. And there are also a lot of people who just have to go to pick up a medication, like they have to see their doctor, but if you could do it virtually or, monitor your medication on your phone instead of having to come in to say you took your medication, I think it would be a lot more efficient.
Awesome. So do you already have ideas for other businesses? I can feel it.
Well, of course. Yeah, I always have lots of ideas.
After this one, Whitney, calm down. That's awesome. Yeah, no, I love it. Super cool. Okay, so Health Bob, Sarah, Steffen, founder of HealthBob, if we want to get involved, or maybe if we want to be notified when this does launch and we all want to jump in, how do we connect with you and stay in touch?
Great question. You can visit our website. It's healthbob.com. And we have a mailing list, and there's a survey you can take if you're a patient in the US and you want to answer a couple questions about your healthcare experiences. And you can also book a meeting if you want to talk with me more about it. So yeah, check us out. And we have a new video, so be sure to watch it.
Awesome. Yes. Awesome. Well, thank you so much for joining me this morning, Sarah.
Well, thank you. It was great to be here.
Awesome. All right, everyone. Take care. We'll see you next time.